Thanks.
Good evening, good afternoon, and good morning. This is the 1671st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. ARPITA CHATTERJEE. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. Our international session is from 8:30 to 9:30, and the local language session in Malayalam from 9:30 to 10:30. We are uploading the videos of the same on the very next day itself, so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, so that the purpose of this forum is to take homeopathy to every home around the world. And let me come to today's guest. As you all know, today our guest is Dr. ARPITA CHATTERJEE. She has completed MD in homeopathy, PhD. She is now doing PhD and CCH CCP MHA London and FM. She is the HOD and Professor, Department of Pathology and Microbiology, Sumandeep Homeopathic Medical College, Gujarat, and is a guest lecturer at prestigious MSU Psychology Department, ITM SLC University, Vadodara, and Sigma University. Chief Physician at Healing Center, Gujarat. So she's having private practice by her own clinic. She's the founder and of the NGO World Healing Society Foundation. I've been awarded the Face of the Year Women 2023 for the social work and homeopathy by Fox India Media. She is the Speaker of Scientific Committee, Aisha. She has won the Best Teacher Award in 2021 by Pearl University. Featured in numerous TV, newspaper articles, and social media pages, and has presented different papers in IFPH at our Hindi as well as in our English sessions. So today, the topic of discussion is contemplating the miasms in modern medicine. So we proudly welcome Dr. ARPITA to the session. Welcome.
Good evening, sir, and good evening to the members who are present at IFHM. I'm very much privileged to have got this other opportunity again to share my views. Today, I've taken a very interesting topic. I mean, this is one of my favorite when it comes to contemplating miasm as per the modern medicine. I have done my MD in organon, so always I would be an organon student no matter what. So there is always this curiosity that I want to understand whatever Dr. Henneman wrote 200 years back. Of course, we can see the results in our patients and everywhere. And we have not been able to refute any of the claims which Dr. Henneman said. But the problem is how to contemplate it, how to make it, look, or not look, actually to prove that what he said 200 years back is quite visible in today's experiments in scientific community. The problem is many a times I face is many a times students come to me and say that miasm is a very outdated concept, madam. Now this something is it's very wrong notion, and sometimes they come with certain thing like, madam, is it cancer? Is it some germ theory? Or is miasm related to some kind of communicable diseases? Now this is the misconception. So when they come with the different, and they ask me about this miasm, that miasm. I only know about 3 miasms, and sora, psychotic, and syphilitic. So keeping that into view, and being a pathology teacher for the last 10 years now, I understood one thing very important, that this is a concept which Dr. Henneman said 200 years back, is something which the community of medicine, the modern medicine, so-called modern medicine, is getting to understand. And I was doing this research for a long time now. Sir, I would like to say that probably this session would take two, because I would not be able to do justice if I am not able to explain the
It,
few scientific terminologies which
yes,
are.
yes, you can definitely take your own time. So we can arrange a second session in April itself.
Yes, that's why I'm asking you for it, because when I was doing it and I had to make it, it's like more than 30 slides. And
Right.
I thought I will not do justice if I'm not able to explain one few of the things which are very new to us as a community of scientists. Because as homeopaths and as medical fraternity, we are not aware of the scientific development which are going on in the field of microbiology, the scientific development which are going on in the field of nanotechnology. So there are few things which we have to take into consideration, the molecular biology, the genetic, the epigenetics things. So these are few things which we have to take, integrate, and understand. So there are so many things which I would like to start with. But before that, I would also like to share my PPT. If you can give me a yes, so I can just start sharing my PPT, sir. Is it? Shall
Yes,
I share my PPT? Yeah. Sir, is my PPT available? Can you see?
yes, yes. It's now it's clear.
Clear? All right. So contemplating miasm in modern medicine. This is like I said. So the concept was given. This concept was given by Dr. Henneman in the year 1828, when he actually wrote about this, that the chronic diseases and their specific nature and homeopathic treatment. So he described it in a very elaborate manner, started from 1828. So let's understand what Dr. Henneman said. So I have just made few points. I have just, it's a vast thing. I have tried to summarize in a few points. So kindly, just take it. So the main points which we understand from Henneman's theory of chronic disease, because I want to correlate it. So I have just made it into few points. The first is all chronic diseases. This is what he said, that all chronic diseases were contamination from outside. That is an acute infection left untreated or suppressed. So this is first thing. So kindly make this point, this one understanding, that Dr. Henneman said that it's a contamination which we are born with, and there is either we are born with or we acquire it if there is an infection which is left untreated or suppressed. So this was his first thing. The second he said is miasms are classified into three types: sora, psychosis, and syphilis. And the third thing he said is most chronic diseases belong to sora. So these are the first three things he said. All right. Then he said the first symptoms are always on the surface, meaning the symptoms would be first always functional. So if I have to make you understand in today's terminology, it's functional. The second thing he said is the cutaneous eruptions and discharge were a compensatory mechanism that was affecting the whole organism. So what he said was whatever we are seeing on the outside is not actually anything local. It is something which is happening internally. Now, if I have to talk about this, so it is like inflammation which happens inside the body. And what we see is the expression on the outside of the body on any particular organ. So that's about the cutaneous eruptions. Now he's talked about this and he said it's a compensatory mechanism. Of course, in when I teach and when we talk about pathology, the development of diseases, so we understand that there is the body always tries to compensate before actually getting into a diseased, more deeper pathological lesion. So it's always there is this mechanism which Dr. Henneman talked about almost 200 years back. Then he said the suppression of diseases leads to internal lesions. Now this is something which is controversial, people say, but if you see the diseases, how the diseases are getting internalized, and which to a certain extent cannot be denied. Even when I'll go forward, we will see how even the medical fraternity is saying that that is a reality, that if there's a suppression of certain diseases, if we do not treat it well, or if the root of the disease is not properly treated, we might have recurrence again and again and again, and it can later on lead to major complex diseases. So, of course, this is what he said. Now, the other three things he said was symptoms vary with different phase of life, it is harmful to treat this local matter. So Dr. Henneman was against treating the local melodies. He was more about treating it internally. And he also said one very important thing, that with different phases of life, the symptoms vary. Of course, we'll understand this when we go forward. Then to cure such diseases entirely, we have to go to its root. And the last thing he said was the correct remedy, that is observable pattern of symptoms expression. Symptoms retreat from internal expression to external expression, while those that appeared last begin to heal first. So he said, if the healing has to take place, it has to come from within outwards. So first the expression, the treatment, the medicine or whatever should go inside. If you're giving the right remedy or the medicine, it should actually first treat the internal problem. The inflammation has to be treated internally, not externally. So if I just keep on, if a person is suffering from fever, if I just give cold application on the head, that will not suffice. So we need to give a medicine which can, so for example, if I give an antibiotic, let's say for example, I'm trying to talk in terms of conventional medicine. So unless and until I'm giving an antibiotic which can kill the bacteria, the fever will not subside. So this is what he said when he tried to make it that internally the expression has to be first subsided, and only then the external expression will go away. The sign and symptoms will go away. But he meant it much deeper than what we actually understand in modern medicine. Now, coming to the point of Dr. Henneman, the other very, we have many pioneers, but one of the most important of them are Kent's, because Kent has had a different, not only different understanding, but he had made an elaboration of what Dr. Henneman said. It's not different. Let me be very clear. Many a times I find people having confusion and saying that they had a different philosophical understanding. I would rather say Dr. Henneman was more. His explanation was more expandable. Meaning that it was more wide range, whereas Kent had taken a few of those things and tried to elaborate it in at his era and according to his understanding. So yes, but this was a very positive development for homeopathy. We will understand how. So he said, Dr. Ken said, predisposition leads to proneness to disease. Now, I would like everyone to please concentrate a little bit here. Predisposition. So understand, Dr. Henneman talked about predisposition. So if I have to acquire any disease, there has to be a predisposition for that particular disease. This is what Dr. Ken said. Now we will understand this in terms of modern science as well. And I'll show you how it is completely true and the medical science cannot deny it. Secondly, it's not the virus that causes the disease, it's the predisposition to the organism. This is a very beautiful line. It is not the virus that causes the disease. Now we have to be very particular about understanding this word. There has to be a predisposition to the organism. So a human body is also predisposed to certain types of organism. The genetic makeup of every person is different, and every ethnicity of depending on the race, the ethnicity, the gender, even the environmental condition, and immunity. These all things predisposes a person to the organism to which the person would be affected. Now, this is very wonderful thing which Dr. Henneman said earlier, which now the medical science is proving. So if I have to give an example, or probably you all remember in Corona, not every one of us had developed the COVID. I mean, the problem which it was not that every one of us had some of them were COVID positive, yet some were asymptomatic, many did not even contact the infection, so that did not even penetrate into their body. Now this is a very big question mark. When it was a pandemic, the entire world was affected, yet there were people who were able to develop immunity. So there were cases reported that few people had developed antibodies, few had could not, you know resist the infection and they succumbed to that and died. Many of them did not develop any kind of symptoms, and very a few of them mild symptoms, and a large portion of the population survived. So this means that there has to be a predisposition to that organism, and the quality of the patient's immunity matters for a disease to occur. Thirdly, he said the consign of a person is, if it is distorted by negative thinking, it leads to distortion of the flow of a simple substance or life force. And it is this that predisposes the organism to all the possible disease. Now, the consign of a person, meaning the way the patient or person thinks, the way the person perceives, the way a person uh, takes the external stimuli internally, and understanding his comprehension of the situation also matters. So in psychology we use the word uh, id, ego, and superego. So yes, a person ego is the whatever I am or you are at present. We have a ego, that is the way our personality is, and within this personality there are two other way of thought processes. One is driven by our internal animal instinct, like which is known as id, and the other one is superego, which is more about the idealistic self about ourselves. So whenever there is a conflict, as per psychology it is said, whenever there is a conflict, that within this two, id and superego, the personality would be affected, and that would lead to psychosomatic disorders. So again, he said, this is what he said, the consign of a person, if it is distorted by negative thinking, it can distort the flow of simple substance. He used the word life force, which was Dr. Henneman called it vital force. And was he right or not? We will come to understand that also. The fourth thing he said was building blocks of life are a manifestation of subtle energy, one calling it as immaterial substance. So he said these life forces are nothing but they are subtle energy substances which are the building block of life. So any life, whether it's a unicellular organism or a multicellular organism like a human body, or a unicellular like an amoeba, all of them are manifestation of very subtle energy. Together, these immaterial substances make a organism. This is what he said. Was Kent right? Yes, of course he was right. Because the first thing which he said was that for a disease to occur, we have to have a predisposition to that. Yes, there are certain specific diseases which are species related. So there are certain diseases which can only happen to a dog or a cat, but it will not affect a human. Similarly, there are certain diseases which can only affect a human, or viral infection which can only, or the bacterial infection which can only affect a human being, but will do no harm to a monkey or a horse or a cow. So see, it is species specific. So of course he was right. The second is, of course, it depends upon the race, the ethnicity, because that is how a genetic makeup differs from place to place, from country to country, from continent to continent. Age related, we have seen that with age, the predisposition to certain diseases increases, and to certain diseases it decreases. So age definitely have a role in development of any type of diseases. Gender specific, of course, any human being will have the hormonal condition and the genetic makeup determines a person's gender. And as per the gender also, our predisposition or our ability to develop, or to be affiliated by a disease depends on that. Hereditary, of course, and the familial proneness to certain kind of infection. Second, um, he said that organism cannot just cause, a virus does not cause a disease. This is what Dr. Ken said. Now see, now example I can give you is that a patient has infection Suppose a patient has an infection, which is rhinovirus infection,
Uh,
and it is present in the mucosa of their nose. Hello,
I,
sir, can you see?
yes,
Uh,
now it is okay. Just for 1 minute it was missing, and now it's okay.
yes, yes, yeah. So a patient has several rhino. Now, this is something which I've taken from a journal. So, see, it says that a patient has several rhinoviruses present in the mucosa of their nose without bothering them. But as soon as they are exposed to cold weather, the number of viruses accelerates exponentially with symptoms of a common cold developing immediately. Now, say, for example, if rhinovirus is responsible for cold or for flu, then if it is present in the nose in the amount which is required, uh, then we should have flu, right? But it is not so. What they have observed over the years is that if there are several rhinoviruses or viruses present in the body, they will remain latent, as we call latent sora. So, it will remain latent unless and until there are certain aggravating factors or there are certain triggering factors. So, this is what, unless and until there's a triggering factor which supports these virus to grow, this will not grow in our body. They cannot do any harm to us. Then, was Kent right when he said that the consign of a person, if it is distorted, if he start thinking negatively, if the perception is not correct about the external matters, then it can lead to predisposition to diseases or can affect the health, of course. Today, psychoneuroimmunology, it's a subject, it's a topic which is at priority. People are working on it, and we cannot deny, but psychologically, the mental health of a person affects the neurological balances, the neurotransmitters, the chemical which releases, even the hormones, and that affects our immunity, and that leads to disease. So, of course, today we cannot deny what Dr. Ken said, and of course, before that, Dr. Henneman already talked about it. How a person's unhealthy mental states, such as overinflated ego, excessive ambition, resentment, fanaticism, or chronic anger, can predispose them to the development of physical illness. Then the last one, what Dr. Ken said was that every organism has started to grow from subtle energy, immaterial substances, which he called as life force, which Dr. Henneman said is vital force. If you see today, quantum physics, even the way I am communicating with you and you are communicating with me today, we are communicating through Zoom. It's a meet which is happening, and this is a mobile where we can see each other. I'm sitting in Baroda, people and all my colleagues of IFHP are sitting in different places of India or outside of our country, and yet we are able to communicate. Why it has been possible? It has been only possible with the development of quantum physics. So quantum physics has made our humanity advance so fast. Today we have AI as well. So who can deny that there's no, that for the development of human life, we do not need energy? Actually, it's a joke when people say that material substance matter. The material substance can only become a material if they are made from immaterial substances. These are nothing but bioenergetic fields. In quantum, in medicals, if the quantum, when it comes to biomedicines, then it is known as bioenergetic field. So this bioenergetic fields are the ones which are responsible for the growth of an organism, for the nourishment, and for the development, and also for the progeny. So this is something which we cannot deny and which we have to agree. If not today, someday, very soon, they have to say this. Yes, there is something called as vital force. They have to give a name, which Dr. Henneman had already given almost 200 years back. Dr. Kent said that he used the word simple substance. Now, miasms. Miasms are responsible. So what the understanding of two pioneers, whereas Dr. Henneman and Dr. Kent, what we understand is that miasm, of course, there are many more pioneers, but I've kept myself restricted only to our father, Dr. Henneman, and then Dr. Kent. Now, miasms are responsible for chronic disease. This is what Dr. Henneman said. So, for the development of a chronic disease, the miasms has to be there. Now, miasm, what are miasm? What did he actually try to convey when he said miasms? So, he conveyed that few things, that there has to be the origin from a specific source of an infectious nature, etc. If such an acute condition is either mistreated or left alone to develop, it will often precipitate into chronic symptoms and pathology. Now, this is something Dr. Henneman said. He said, if an acute infection, if a person is suffering from an acute infection, now please think 200 years back when there was no theory of germs, he talked about that era, and he's saying that if he did not know what is a virus or a bacteria, he did not know what is DNA, but he said if a person is suffering from acute infection repeatedly, and if it is not treated well, if it is not taken out of the system or the body, this would lead to chronic diseases. Now, in pathology, when we talk about the etiology of chronic diseases, one of the etiology is the recurrent infection. Acute infection can lead to chronic infection, can later on convert into chronic infection. Now, or chronic inflammatory disease process. This is according to pathology, which Dr. Henneman was not aware when he talked about 200 years back. But he said whatever he said is true. In when we talk, we read in our pathological books, Harsh Mohan, it is clearly mentioned that one of the etiology for the development of chronic diseases is that there has to be repeatedly, if we are having acute infection, and if it is not treated well, or if it is not controlled, it would lead to chronic manifestation or chronic disease symptoms. All right. The second one is an infection should have a tendency to produce sequel of deeper pathology if left untreated or suppressed. Now, second thing, if you see the geniusness of Dr. Henneman, he said very beautifully that if an infection should have the tendency to produce a deeper pathology. Now, if I have to talk about, like, we suffer from chickenpox when we are as a kid. But if you see, there are certain viruses which have a limiting, self-limiting, they are self-limiting diseases. So if a child is suffering from chickenpox, after he has suffered, there are not, because it's not very deep, so the chances of having chickenpox later on in life becomes null, because the antibodies are developed and which remains throughout the adult life. Now, Dr. Henneman was not even aware of antibodies, but still he said that whatever infection, it should have the tendency or should have the power to go deeper. So not every infection will lead to this. So we are very, very much aware that not every viral infection leads to chronic diseases. There are only few types of viruses which has the ability to penetrate into our genome and cause destruction, or can do deeper pathological problems. The third one is if its chronic effect can be transmitted to the next generation, not as a primary infection, but as a predisposition via the genome. Now, this is again very beautiful if you see that he said this infection, these kind of infection, when they are transmitted from the mother to the child, it is not transmitted just like the disease it was in the mother's body, or in the way it was in the mother's, or the symptoms in which it was reflected, but it would be in a different form, or it would lead to a predisposition to that kind of diseases. So, and those infection would be transmitted through the genome. Now, this is genome, he did not say. This is what I have written to, for for all of us to understand. He said 200 years back that it should have this effect, the chronic effect can be transmitted to the next generation, not as a primary infection, but as a predisposition via the genome. What he said is something on which the scientists are actually working, and there is a word I will tell you. It's known as bacterial memory. one you all know is about the viral genome transcription. So viruses are either in the DNA form or a RNA form. They can go into our body. They can like rubella virus or measles and all this. So and we are also aware that there are certain viruses. If a mother is affected with, it could go to the fetus and will lead to some congenital defect like neural tube defect or heart defect, septum defect. So some or the other defects, congenital. And sometimes if it doesn't go that way, it predisposes the child to certain type of viral infection. Now about this, even when I go further in that, we'll see how the modern science have talked about bacterial memory. Now this is very beautiful concept which will be understand. I do not know whether I would be able to complete this session on the next session, but yes, we will talk about bacterial memory, and we will also talk about the viral genome, how it influences from generation to generation. Even bacterial memory, how it affects from one generation to another in the human kind and also in their own colony of bacteria. Then he said. Then Dr. Henneman also said that miasms are responsible for chronic diseases. When required, he said that the nosodes from the infectious agent like medorinum, syphilinum, sorinum, tuberculinum should be able to cure a sufficient number of cases which present the relevant symptomatology. So he said whenever there's such infections are there, if such nosodes are developed, it would help to cure such diseases. And interestingly, we are the researches which are happening with homeopathy at different level with microbiology department or with the department of other modern sciences. So we are seeing that how beautifully we can develop nosodes. I'll also share one news article where it has been shown that how tuberculosis can be treated with the nosode. I'll share that at the end of the session today. Then, the miasmatic condition, underlying pathology of one of the parents, is not necessarily passed on in an individual manifestation of the child's pathology because it is always modified by the condition of the other parent's health. Now, another thing, Dr. Henneman said the manifestation of the SORA, psychosis, or syphilitic will not be the same when it is passed from generation to generation. It would be different. Now Dr. Henneman did not knew at that point of time about DNA, or even the entire fraternity was not aware of it. So still he said the manifestation will be differing. It was only through his reflective observations. You see, this is very interesting. This man was genius. The way he observed, the way he was observing symptoms, the way he was analyzing them is marvelous, because in spite of not knowing any of this terminology like genome, viral DNA, all this thing, he said that the manifestation of the disease will not be the same one. Why? He was not knowing. But then in today's thing, it is like when a mother, in a mother's womb, when a child is conceived, the DNA of the child will contain 50% maternal DNA, the 50% paternal DNA. And the genome will be different, not the same exactly like the mother or the father. And that is the one, that is why the expression will be modified. That's such a beautiful thing which he said so many years back. Now, as per pathological understanding, now coming to pathology, now coming to the medicinal part. Now, up till here, I hope I'm very much clear in making understand all of you that what Dr. Henneman wanted to talk about for chronic miasm, how it develops, how we can treat it, a little bit of all of that. Now, when chronic diseases are to be understood as per pathological understanding, like modern medical understanding of, and what is pathology? Pathology is the abnormal study of abnormal function and the development, pathogenesis, how the disease develops. Now, this is the understanding. Now, what are the understanding? So, chronic diseases cannot be prevented by vaccines or cured by medication, nor do they just disappear. This is a line which you get to read when you talk about chronic diseases. And if you see, doesn't it sound very similar to what Dr. Henneman had written in our Organon of Medicine? So chronic diseases cannot be prevented by vaccines, but of course he did not use the word vaccine in his time. There were none, so that's why. But he said it could not be cured by medications. So yes, it cannot be cured by medications alone. It has to be by many other things. And nor do they just disappear. Of course, they do not disappear by their own. Secondly, the chronic diseases are always complex causes. They will always have complex cause. There are many risk factors which are involved. Long latency periods. There is the time between the onset of the illness and feeling its effect are a little long. So there is latency period is there. A long illness, and later on it will lead to functional impairment or disability. Now, this is what is the very uh, precise understanding of chronic diseases as per the modern pathology. So, for the development of the chronic diseases as per pathological understanding, what are the factors which will lead to any kind of non-communicable chronic diseases? All right, and even there are communicable chronic diseases as well. But here we will be just focusing on non-communicable chronic diseases. So what are they? Those are socio-economical and the environmental determinants like globalization, urbanization, population, age. Now, second is the modifiable risk factors like unhealthy diet, sedentary lifestyle, heavy smoking, alcohol. Non-modifiable risk factors like age, hereditary. Then physiological and biological risk factors like high blood pressure, high blood sugar level, abnormal lipid profile, overweight or obesity. And all of this will lead to ultimately what? Either they will suffer from some chronic disorders of the neurology or maybe hormonal or cancer or respiratory or heart diseases. So different. The manifestation could be any of these things. So this is what is the understanding, the very precise understanding of by the modern medical fraternity is that there has to be these three. They have just categorized that socioeconomic and environmental factors are responsible. Plus, there are factors which can be modified, and there are factors which can't be modified, which are equally responsible. And the other one are the changes that happen, physiological and biological changes, which if they occur or there is an accumulation of all those things, together will lead to this. Now, I would ask all of you, is this reminding you of any of the aphorism? If it does, then I think we have made a progress. So if you read it properly again, I'll ask you to read, all of you to read this. If you can see it properly, it would remind you of an aphorism. And for chronic diseases, Dr. Henneman said that we need to take into consideration all of these things. And when we are doing case taking, many a time it's very funny when people ask me why our case taking are so long. It has to be because we have to understand the positive, the reason for development of the chronic diseases. And you see, these are the factors. So does it remind you of the aphorism? It's the aphorism number 5, where Dr. Henneman said that in order to understand the chronic disease, the development of it, and what all, we need to take all these things into consideration: the age, the gender, the constitution, temperament, social and family relationship, personal living mode, habits, environment, sexual function, etc. Can't you see all of this covers? See, I'll just go backward. You can see the socioeconomic environment, factors like living factors, the mode of living, you can see diet, smoking, alcohol. Then factors like constitution, you can see the age, heredity, and temperamental, physiological and biological markers like this. So if you see habit, all these things together constitute the development of the chronic diseases. So there is the beauty of our science is that we can, when we go forward, we can see that there is more and more valid explanation of what miasm is actually. The 4 factors causing chronic diseases. Now, this is very important. Here is something which we need to understand to ultimately understand what chronic disease is. This is as per the modern science. As per the modern medical science, as per it, till this, I mean, but in the year 2025, we don't know how much development will take place by next year or even 5 years ahead. So till 2025, these are the understanding that there are main four factors which can cause chronic diseases. First is oxidative stress. Oxidative stress meaning if there are reactive oxygen species or nitric oxide species, if they are produced in high amount in our body, this could lead to chronic diseases. Second is mitochondrial dysfunction. Now, this is a very new molecular biological advanced studies which are going on. So they have seen that the mitochondrial dysfunction is one of the reasons for developing many of the chronic diseases. Then chronic inflammatory diseases due to recurrent acute inflammation or inflammatory condition, which we have already talked, like repeatedly having suffering from viral or bacterial infection, can later on lead to chronic infection, chronic inflammation, and microorganism. So these are the factors. These are the factors which can lead to the development of chronic disease. Now, what is actually chronic disease? In chronic disease, what happens is that the body is unable to control the dysfunction, the body is unable to control the damage which happens, and especially the damage happens at the level of the nucleus. When the nucleus is destroyed completely, at that point of time, the body undergoes some changes, some irreversible changes, which leads to development of the chronic disease. See, let me tell you, for a disease to develop, as per the pathological understanding, a disease has to first it develops in the form of functional changes, meaning it is reversible. So there might be some sign and symptoms which could be revert back. There are certain subtle changes in the body at the level of biochemical changes would be seen, which can be revert back. If once it is reverted back with the help of proper diet, exercise, food, or medicine, once that is done, it will come back to normal. It will not develop into a chronic disease. The second thing that happens is the adaptation. Sometimes the body is unable to undo the changes. So when it is unable to undo the changes, what it does, it tries to compensate. So there is a compensatory mechanism which happens in the form of hypertrophy, hyperplasia. Hypertrophy means increase in the number of increase in the size of the cell. Hyperplasia meaning increase in the number of cell, or atrophy. So these things happen. It's a kind of compensatory mechanism where the body tries to compensate for the problem or the damage which is happening, although the damage is not at the level where it is irreversible. It is still reversible, but when it goes to the stage of irreversible damages, which actually includes the damage to the nucleus. So the nucleus damage could be of three types: pycnosis, cryolysis, and cryoxis. So any of these three types of destruction, if it happens, it could lead to chronic disease development. Now, these are the four factors. Now, we have to understand what basically how body tries to stop this. Okay. Now, I hope I'm very clear in making you understand that what are the four basic factors which can cause a disease development, chronic disease. Here I'm talking just about the chronic disease. So it is the oxidative stress. If it is if there's high accumulation of reactive oxygen species, there's high possibility of it. Second, mitochondrial dysfunction. This is a very elaborate and beautiful topic. The third one is chronic inflammatory due to recurrent acute inflammation, and then microorganism. And of course, there has to be damage later on, and the damage has to be at the level of the nucleus. When the damage is at the nucleus only, then it can turn into a chronic disease, not before that. Let me be very, very clear here. Okay, because chronic disease is not a self-limiting disease. It cannot revert back before without with the help of just vaccines or medications. So it is something, and it is like a prolonged illness which later on lead to death of a person. So yeah, the damage which happens if in a chronic diseases are basically progressive ones. All right. Now, what the medical fraternity are talking about, this, how does the body stop it? See, the thing is, even at even if we are exposed to the pollutions, to the various type of uh, noxious agent, still not every one of us is suffering from a chronic disorder. Or let's say, for example, we see, people, there are people who keep on smoking and they are smoking every day, yet they do not suffer from lung cancer. But then there is other person who is not have not ever been exposed to um, smoking or alcohol abuse, and still that person uh, gets cancer of the lung and dies. So why this? So there's this question mark. And even smoking doesn't actually cause the disease. What is it in the smoking that triggers it matters actually? So this question is very important for any scientist to understand what it is basically. Is it the smoking, or is it something else in the person's body which is predisposing this person to develop a certain type of disease process, which we in our terminology talk as SORA, psychotic, and syphilitic. So a person will have a particular kind of predisposition to certain type of diseases, and therefore the expression would of that disease would be also in that form. If it's SORA, it would be more of a functional type. If it would be psychotic, it would be more of overgrowth, overproduction, overdestruction. And if it is about uh, syphilitic, there would be destruction and there would be just uh, damage and destruction. So if we understand this from a homeopathic point of view, I personally feel that we have got to that ground where we have accepted. Dr. Henneman had already made us understand that every body has a is built in a way there that it can predispose that person to certain diseases. But here in medical science, still they have not reached to that point. They are just on the surface trying to understand the factors which are causing it, the etiological factors, the reasons for it, but yet they have not understood the basic pattern. Dr. Henneman had talked about a pattern. Now they haven't reached to that point, but they are actually trying to reach to that point. Here, I'll to make you understand this, I'll talk about the word autophagy. Now, this is the point. This is very interesting. Here, what the scientists have observed, that for a person to develop chronic disease, the body's autophagy, meaning that we all have system in our body in which if there is a DNA damage, or if there is a damage to the nucleus, or if there's a damage to the cell, what happens is that our body recognizes it, and the moment it recognizes, it goes, it take its it eat it, and it digests that damaged DNA or the damaged cell or the damaged product. All right. So it's an which is known as autophagy. So it's a mechanism which is intact in each or one of us. Now, the very interesting thing is that it is seen that people who suffer from chronic disorder, they have a problem with this autophagy, meaning in few people the autophagy system are intact, and that's why they will not fall sick. And in certain cases there would be accumulation of the toxin material. They might show certain type of disease, the compensatory mechanism like overgrowth, overproduction, and certain sign and symptoms as well. If that is not controlled there, then this will automatically lead to a complete failure of this autophagy system, and the person will completely land up into complex chronic disease. Very interesting, right? So we know that. Now if I have to ask you, a person who can make sure that the autophagy system is intact and is making sure that all those damages which are happening due to the environment, due to the food, due to the living mode, due to age, if that is being autophage or being taken controlled by the body, so we will hardly suffer from any problem except for the functional disorders which are sora. So in a way, this person's body is soric. The autophage system is intact. In the second part, where there is the autophage system is somewhat not able to clear these kind of damages, what it does, it tries to accumulate them and keep it aside to do what? To keep the effect of the toxicity mild to a lesser degree. And the third, when it completely fails to do that, it leads to destruction and the progressive chronic disease. Isn't this very similar to our miasm? So here I'll show you two things. There are two systems which operates. One is the autophage system, where the body understand and that there is some damage which has happened somewhere, and that damaged tissue or the thing has to be cleared, removed from the body. Then there is another system, that is the UV system, which we'll talk about later. Now that UV system does what? It goes and attaches itself to that damaged DNA or to that damaged cell, and then it signals the body that to come to send those autophages and eat that damaged thing or destroy it through the process of lysosome or lysis. So it breaks it down. All right. So there are two systems. Either they do it with the help of some enzymes or some protein. It is not enzyme, basically, it's a protein which comes and it is known as UV. It goes and attaches itself to that. It's an amino acid, basically. It goes and attaches itself to the damaged part. And sometimes it doesn't have to do it that way. The damaged things are identified by the body and they are taken in and eaten away. So there are two ways. Now, autophagy is regulatory system. So these are operated by two phases, that is UPS, like I said. One is the UPS, these are the amino acids or the protein, which are known as ubiquitin proteasome system. And the second one is autophage lysosome system. Okay. So ubiquitin proteasome system and autophage lysosome. Lysosome, we all know it is present in every cell. So even a unicellular organism has this intact in their body. So we are a multicellular organism. So that's why we have a more elaborate. We have autophage lysosome system as well as UBS, that is ubiquitin proteasome system. The de-ubiquitin enzymes that negatively regulate the autophagic protein degradation mammals have rarely been possible. So there are very less such enzyme which stops autophagy. So if ubiquitin system has started, like if that is being if this UPS system, that is ubiquitin proteasome system, if this system is triggered, it will start eating everything. Yes. Now, it has to see, this UBS system is a very potent system. Potent in the sense that it should work properly. It should know we should understand that this is defective and this is not. If that understanding of UPS system is somewhat distorted, disturbed, it can even start autophaging or killing those cells which are good. So this is a very sharp edge thing. Then the first cytoplasmic protein, so that is what happens in autoimmune system. So when we talk about autoimmune,
Doctor, only just 4 minutes remaining, and shall we conclude here and then we can have the second session?
Yes, sir. Yes, sir. So that's why I just want to end it here only. That
Okay.
so clearly, it's a self-regulating system. So thank you, all of you, for patiently listening to me. As I said, the Dr. Henneman said that bodies are of, there is a system like SORA, psychotic, and syphilitic. It's the MIASMS and individualization. So again, if you see, the autophagy is also a self-regulatory system. So definitely it differs from person to person. And the rest of the thing we will do in the next session, because as I said, this is a very elaborate.
Yes, only few minutes remaining. That's why
Yes, sir.
we can
Yes, sir.
have a second session. You can stop. Yes. Yes, anyway, it's really a great session. You really show the theory how important for us. Anyway, as you rightly point out in between that the COVID, most people affected COVID, but some of us didn't affect COVID, and we, as most of our doctors didn't take this vaccine, but still we are living without COVID, and that's another point to be discussed because we have the immunity, our own immunity system, and our homeopathic medicine can boost the system in that way also. That's why the CCRH has made a presentation and they have submitted the research work at the Supreme Court of India, and thereby the Supreme Court allowed us to go ahead with our preventive mechanism as well as our treatment for as we all know that there is no treatment for viral diseases in case of these allopathy people, but still they want to treat from their COVID with their medicine. That's the reason why the number of casualties were very high. COVID didn't kill any person, but the
Exactly.
so-called medicines are killed because most of us have treated more than 5,000, 10,000 cases, but no one
True,
has
sir.
died. So that's a kind of
True.
thing. Anyway, I mean, wait, yes, Rambadesa, sir, want to say a few verses. You can speak now, sir. Then Dr. Indani Bhavatkar will say lot of thanks as well as some. Yes, yes,
Thank you. Thank you, Dr. Dhanesh ji, and congratulations, Dr. Arpita Chatterjee madam. Very nice presentation. Excellent
Thank you, sir.
session. Describe the miasm. Very good. Describe the miasm. Main cause of disease according to law of homeopathic science.
Yes.
Miasm. Sora,
True, sir.
psychotic, and syphilitic. Sora is the functional diseases, and psychotic is the
Overgrowth.
extra growth the organs, and syphilitic there are two symptoms, objective and subjective symptom. Destroy the organ, damage of organs is called name of all miasmatic diseases. So very thanks, Dr. Arpita Chatterjee, King of Pentisoric Remedy, Sulfur, Queen of
sir.
Soric Remedy, Suriname. So very thanks. Thank you, Madam. Behalf of IFPH whole team, very thanks. Again presentation. Thank you.
Yes,
Thank you, sir.
it's up
Thank
to Dr. Indani Bhavatkar to say a few words.
Yeah, madam, actually, I would like to ask you a question which will be applied for the next time. I'll keep it reserved for
Yes,
you.
sir.
Yeah, because
No
the time is
problem, sir.
very
I'll do some research before coming for the next session.
yeah, time is very short. So, on behalf of IPH and our team, we extend our heartfelt gratitude to Dr. Arpita for sharing such an insightful perspective. And your expertise has enriched us with some good knowledge, and it is an addition to our knowledge. I am thankful to the attendees also, and we look forward for your next session eagerly. So, kindly arrange it as soon as possible. Huh? Thank you,
I'll
Doctor.
try to do so because yes, sir, I'll definitely. And if you have a question, please send
Surely,
it to me so that I
surely,
can do
some
a little bit
questions
of
are
research more.
waiting for you, and it's for benefit of all. Next session will definitely have it.
Thank
So
you.
thank you, sir.
Thank you, Dr. Indani Bhavatkar and Dr. Arpita Chatterjee and those who attended the session in this evening. And tomorrow we will have a session from Dr. Shalini, and she will be talking about tuberculosis and its homeopathic management. And with that, we come to the end of the day 1671. Thank you all. All of you can join and tomorrow by using the same link that we shared for you tomorrow today. Good night. To Dr. Mariamma John to moderate the Malayalam session.
നന്ദി